reason I'm kind of educating you on the tip is because at any point in time when you go visit a physician, you got to know what kind of tip they're using. They might be using a blue tip, they might be using any of these tips, but unless you know exactly which one they're using, it's hard to know what kind of treatment you're getting. So education is key. So always ask your physician, what tip are you using? What color is the tip and how many pulses does that tip have? This first tip, as we call it, the slow tip, it's dark blue. It delivers 100 pulses of energy, and it's about 1 centimeter in diameter. This was the first one that I used. This was the first tip that was available many years ago. And basically, we would just put the tip on, and the computer would actually read what tip it was, and then prepare itself for a treatment. The second tip that was released is the light blue tip. It's called the 1.5 centimeter tip, and it comes in various sizes, anywhere from 100 all the way up to 1,200 pulses. And this was used whenever we got an expanded coverage for the neck, so that we could actually treat the neck quicker and faster. This tip delivered energy faster, and it obviously covered more surface area. So we were really excited when this thing came out, and we were comparing it to the old 1 centimeter tip. It's much faster. Like, I don't even think many people use this older tip. Then came out the eye tip. When we started doing the eye treatment, eyelid treatment, as well as the lip treatment, and the hand treatment, this tip was very popular because, as you can see, it's small enough to treat in these small areas around the lips and around the eyes. And this one has what they call a shallow profile, where the heat doesn't go nearly quite as deep. So when people ask, you know, does the does your Thermage treatment include the eyelids or the lips? Well, naturally it doesn't, because if you do want that tip, it's an additional charge to use an additional tip. And then finally, let's see, the fourth tip that was released is this 3 centimeter fast tip, and they call it the medium depth tip, that was released. And it obviously increased the speed of treatment by 3 times compared to the first 1 centimeter tip, as you can see the difference, and twice as fast as the 1.5 centimeter tip, so you can see the difference between the two. And again, this comes in different nomenclatures of pulses as well. Then a few years later came out the deep contouring tip, which is recognized by yellow color. This deep contouring tip delivers radio frequency into the tissues very deeply, as compared to the light blue tips or the blue tips or the green tips, which are very superficial. And the blue tips generally represent a medium depth penetration, whereas the yellow tips represent a very deep penetration. And the green tips are very shallow penetration. And that's kind of the way you can identify the tips when you're looking at them. Well, lo and behold, there came out another tip. It's called the Cellulite Tip. And this one is red. This tip is a 3.0 centimeter tip, and it actually penetrates the skin about the same depth, about a little less than the medium tip. It's going to be along the same depth of penetration, maybe a little deeper than the green tip, but it's used for actually improvement in cell dimpling and cellulite. And then came along the new excitable 16 centimeter deep contouring tip that was released last year, and we thought, wow, this is really nice, because now it's, you know, it's 4 times bigger than the older 3 centimeter tip. As you can see, it's 4 of these. And the neat thing about this tip, when it was released, is that it actually has a firing profile that is random. And by doing so, the patient experiences less discomfort and greater heating in a specific area. You thought Thermage would stop there, but they haven't. They've actually moved along to finally their latest and greatest tip, which is the one that was released just a few days ago, which is the new enhanced heating profile 16 centimeter body tip. And this tip, as you can see, is quite a bit different, even though they're the same color, than the predecessor from last year. This one delivers heat more uniformly over the area. It heats the tissue much more evenly, and it provides a much more comfortable profile.